Hi guys, this is registered nurse Chima on Tutormechima. So today we're actually going to be looking at a very interesting topic, which is the anatomy of the thorax. Okay, so you guys, we're going to take concept from Mrs. Kosi over here. Okay, hi Miss Kosi. I want to use you. You know, your body is okay, looking so good. Okay, I want to use it to just teach them a little bit about the thorax. Now I proceed. Mrs. Kosi said I should proceed. Okay. Okay, so after seeking our concept from Miss Kosi here, we're going to proceed. Okay, now the thorax actually starts from the base of the neck, that's from the first rib, okay, to the diaphragm. What's the diaphragm? The diaphragm is a muscle, and this muscle is a dome-shaped muscle. So if you look at this image here, you can see this muscle, this red structure you can see under the ribs is actually called the diaphragm. What it does is that it separates organs in the thoracic cavity from the organ in the abdominal cavity. Okay, now when you're talking about the thorax, anteriorly we can see some bones that make up this thorax. We're going to talk about the first one. We have what we call the sternum. The sternum is also known as the breastbone, and it has three parts. It has what we call, this part here is called the manubrium. Okay, then it has the body, and it has what we call the xiphoid process. And in this manubrium, it actually has notch, this area here, this concave depression here that actually attaches to this bone that we can see here. This bone is called the clavicle, and you can see it you can palpate it in 10 individuals. You can even see mine. I think mine is visible. Okay, so it is called the clavicle. So the clavicle attaches to the sternum at a joint called the sternoclavicular joint. Okay, then next we have this, the manubrium, and you can see in this manubrium here, the first rib attaches to the manubrium, and part of the second rib attaches to the manubrium. How do they attach to it? You see this structure here, you can see it here. It is called the costal cartilage. It's not made up of bone. What happened is that these ribs here terminate at what we call the costal cartilage. It is this costal cartilage that actually attaches itself to the sternum. So the first rib attaches to the manubrium, part of the second rib attaches to the manubrium, then the other part attaches to the body. From the third to the sixth, this is the third here, from the third to the sixth attaches to the body of the sternum. Now we can see the xiphoid process here. This xiphoid process is mostly cartilaginous. It's around the age of 40 that it completely ossifies. Okay, now we have 12 ribs. Okay, and out of these 12 ribs, actually 7 are called true ribs. What do I mean by true ribs? These ribs are the ones that are actually attaching itself to this breastbone here. So we have the first rib, the second rib, the third rib, the fourth rib, the fifth, the sixth, and the seventh. You can see it attaches itself directly to the breastbone. But from the 8th to the 10th, that's counting from these 8, 9, 10. What they do is that they attach to the cartilage above it. So they are called false ribs. Then the remaining 2, because I told you it's 12 ribs, you can see it posteriorly. Okay, turning this to the back, you can see it posteriorly. They are called floating ribs. They don't move to they don't cover to the anterior part. So they are called floating ribs. Now posteriorly, looking at the posterior aspect of it, we can see that the thoracic cavity actually starts from, we can see this structure here. This is actually called the vertebral bones. Okay, in the posterior aspect of this thoracic cavity, the ribs actually attaches to the vertebral bones, and there are 12 thoracic vertebral bones. From the first rib here attaching to the first thoracic vertebral bone to the 12th thoracic vertebral bone. Okay, yes. Then we can also see the ribs coming to the back here. This structure that you can see here is called the scapula. Okay, it helps to anchor, it helps to form the shoulder girdle with the clavicle, so that the hand can attach to it, the upper limb can attach to it. Okay, so I'll just summarize what I just said. I said that the thoracic is commonly known as the chest, and it starts from the base of the neck to a muscle called the diaphragm, which I showed you. This is the diaphragm here. And the base of the neck, what starts is actually the first rib. Okay, you can see it here. The first rib attaches to what we call the breastbone, which is the sternum. And this breastbone is made up of 3 parts: the manubrium, the body, and the xiphoid process. And I told you that out of these 12 ribs that we have here, 7 ribs actually attaches itself to the what? Breastbone, and those 7 ribs are actually called the true ribs. While the first ribs are those ones that don't actually attach itself to this, directly attaches itself to this breastbone, and there are 3 in number, from the 8th rib to the 10th rib. Then the 11th and 12th rib, I told you, they are called the floating ribs. I told you behind this rib actually joined to the vertebral bone, what we call the thoracic vertebral bone. Okay, so with that, I hope you understand the bones of the thorax. Okay, so make sure you like this video, comment down in the comment section, and most importantly, subscribe. Anything you find difficult, just comment it down in the comment section. Okay, so in my next video, we're actually going to talk about the organs you can find in the thorax.